Chances are, this is how you look right now. And like most, you likely have been told countless times as a child to stop slouching and sit up straight. From infomercials to doctor's offices, such an emphasis has been placed on maintaining good posture that it has essentially gained commandment status. Many medical and health professions are relentlessly engaged in an endless battle of ridding the world of bad posture. This has led to the rapid growth in the global posture correction market, estimated to have earned over $1 billion in 2021. This includes the sales of a variety of products designed to improve posture, such as kinesio tape, back braces, lumbar supports, and this device called the Hunch Stick. If only Quasimodo had access to this thing. But is maintaining proper posture as important as it's cracked up to be, or just much ado about nothing? Posture is not simply one position, but in fact constantly evolves throughout the day and depends on the challenges that your body experiences at any given moment. It is influenced by a pattern of body reflexes, habits, and adaptive responses that are wired into us on a biological level, but also learned and influenced by social and environmental factors. These various postures help us to perform daily tasks, respond to our environment, and for communicating emotions through what we consider body language. There are several allegedly poor postures that have gained attention throughout the years, but none are as notorious as upper cross syndrome. If today's society had a statue erected in its image, this is the posture that the sculptor would use. Popularized by the Czech doctor and researcher in the 70s, this slouched posture is a classic example of the so-called muscle imbalance theory. This theory states that poor posture is a result of a combination of inhibited or weak muscles and overactive or tight muscles, and is thought to lead to pain within the spine and surrounding soft tissue. Although this concept sounds plausible and relatively easy to wrap your head around, the evidence supporting its use is questionable at best. For one, there is a lack of agreement as to what exactly good posture looks like, and two, there is no valid or reliable means to measure posture. Commonly utilized clinical tests are extremely subjective, and even if an individual is identified as having poor posture, there is a strong body of evidence that has shown no correlation between posture and pain. There is even some evidence showing that individuals deemed to have good posture report just as much pain as those with bad posture. There are even some cases where bad posture can actually be beneficial for the individual. For example, people with symptomatic lumbar stenosis often respond favorably to a more flexed low back posture, as this position opens the joints in the back, resulting in less compression of the nerves in this area. But despite the clear lack of evidence supporting the influence of posture on health outcomes, the concept remains prevalent in the healthcare community. A 2019 study asked several hundred physical therapists to rate the importance of optimal sitting and standing posture, and 94% considered posture considerably or very important to improving patient outcomes. But there is a significant lack of quality evidence supporting this concept, yet a high number of professionals still hold these beliefs. The chiropractic profession is arguably the worst offender driving postural misconceptions, due to the fact that chiropractic care is baked into the concept of achieving perfect spinal alignment. Chiropractors commonly utilize antiquated diagnostic tools such as X-rays and other ineffective assessment techniques to assess spinal alignment, despite a strong body of evidence showing no association between the curvature of the spine and pain symptoms. So does that mean there is no such thing as poor posture? Well, no. Poor posture definitely exists, but not to the degree or importance that we are led to believe. Treating pain related to posture is less about arbitrary observations and corrective treatments based solely on these observations. Again, not all people with poor posture have pain, and not all people with good posture are pain-free. Pain related to posture is more related to a person's inability to cope with the physical stress that the certain posture puts on the body. These postures can be self-imposed, compensation strategies, or brought on because of work or sport demands. The posture itself is not inherently harmful, but if the person does not have the ability to attain or support the posture demands, then it can be problematic. So what can be done about it? Well, the first step is identifying the demands that the posture places on the body, as this will tell you what your body needs to be able to do to sustain the posture. Whether it be improving ergonomics of the task being performed, improving flexibility to be able to get into the certain position, or improving strength to hold a position for a period of time. But getting out of the posture may be more important than modifying the posture itself, with a number of studies demonstrating the impact of sedentary behaviors on postural-related pain. Prolonged time spent in a sitting position has been linked to an increased risk of developing chronic neck and low back pain, with the sitting posture not appearing to be a factor. So do yourself a favor and get up. When it comes down to it, there is an undeserved emphasis on the importance of posture in society, which has been perpetuated by postural-related theories that are as crooked as the postures they are trying to correct. Making things worse are healthcare providers subscribing flawed assessments and treatment methods that stoke fear in their patients, and the retail sector selling unnecessary and often ridiculous postural correction devices. There is likely a stronger association of postural-related pain on the lack of movement, more so than the posture itself. Posture is a complex interaction of multiple factors, and this black and white view of good versus bad posture is overly simplistic and just misleading. While I hope you enjoyed this episode of Physio Show, make sure you like and subscribe to our channel to receive more physical therapy related content.